All right, today we're diving into a drug that is a true double-edged sword. On one hand, it's a lifesaver. On the other, it can be a serious liability. It's called Itraconazole. It's a powerhouse against some of the gnarliest infections you can get, but it's got a dark side that demands you handle it with extreme care. So, let's get into it.
So I want you to just imagine this for a second. An infection that's not just on your skin, but has set up camp deep inside your body. We're talking in your lungs, in your bones, maybe even your brain. How in the world do you fight an invader that's literally hiding out in your own tissues? It is one of the toughest fights in all of medicine.
And that's exactly where itraconazole comes into the picture. It is designed for these deep internal battles. But here's the catch. It requires an incredibly careful balancing act. The line between a cure and a really serious problem can be razor thin. And let's be super clear here. We are not talking about something like athlete's foot. No, we are talking about systemic fungal infections. These things are aggressive, they're deep, and they can spread through your whole body, becoming totally life-threatening, especially if your immune system is already weak.
So, for a lot of these nightmare scenarios, itraconazole is the solution. Think of it like the special forces of antifungal drugs. It's the heavy hitter that doctors call in when they need something powerful enough to travel through the bloodstream and hunt down these infections no matter where they're hiding.
And its hit list is pretty impressive. It's used for everything from incredibly dangerous lung infections like aspergillosis all the way down to that stubborn, nasty nail fungus that you just can't seem to get rid of. It's the go-to for a whole range of really tough cases.
Which brings up a really cool question, right? How does this thing target a fungus so precisely without wrecking our own cells in the process? Well, the answer is some seriously clever biochemistry.
You see, the secret is that itraconazole doesn't just poison the fungus. It's much more elegant than that. It systematically dismantles its defenses. It goes right after the very thing holding the fungal cell together, that protective outer wall.
And the attack is incredibly specific. Here's the play-by-play. Itraconazole blocks a special enzyme that fungi need. This enzyme helps them make something called ergosterol. Now just think of ergosterol as the bricks and mortar of the fungal cell wall. So if you stop the fungus from making its bricks, the wall gets weak, leaky, and the whole structure just falls apart. The cell literally can't survive.
And this, right here, is the genius part. Fungi use ergosterol for their cell walls. But what do we humans use? Cholesterol. They're similar, but different enough. Itraconazole is designed to sabotage the ergosterol factory, which means it can cripple the fungus while leaving our cholesterol-based cells totally alone. It's a perfect example of targeted therapy.
Okay, so it's a brilliant fungal assassin. Sounds amazing, right? Well, here's the twist. Just getting the drug to the right place inside the body is a huge challenge. And this is where the story gets complicated.
Let's start with its superpower, because it really has one. It's amazing at something called tissue trapping. That means it doesn't just float around in your blood. It actually builds up in super high concentrations in the exact tissues that are infected, like your skin or your lungs. So once it gets there, man, it is incredibly effective.
The problem is getting it there. This drug is so picky, it needs to be taken with a full meal because it's fat-soluble. And even more critical, it absolutely needs a highly acidic stomach to be absorbed. So you know those common antacids people take? They can make this drug almost useless. You might even be told to take it with a cola just to get the acid levels right.
But the biggest problem, the real drama, happens in the liver. See, our liver has this system called CYP3A4. You can think of it as a massive, multi-lane superhighway that breaks down most of the drugs we take. Itraconazole doesn't just use this highway. It shuts down a bunch of lanes, causing a huge traffic jam for everything else trying to get through.
And that traffic jam is everything. When itraconazole blocks that metabolic highway, any other drug that needs it gets stuck in a massive pileup. Their levels in the blood can skyrocket to dangerously toxic concentrations. And this isn't some minor side effect. This is the reason for the drug's most serious warnings. And those warnings are as serious as it gets. We are talking about black box warnings. That is the highest, most urgent alert the FDA can put on a medication. It basically means there's a risk of severe, sometimes fatal side effects that absolutely have to be managed.
And just look at this table. The interactions are no joke. For instance, you combine itraconazole with certain heart rhythm meds, and it can cause fatal arrhythmias. You take it with common cholesterol drugs like simvastatin, you risk severe muscle damage.
With some sedatives, it can lead to dangerously prolonged sedation. These are combinations that you simply cannot have.
And that's not all. Beyond the drug interactions, itraconazole itself carries major risks. It can actually weaken the heart's muscle contraction, so it's a no-go for patients with heart failure. It can cause serious liver injury, even liver failure, and it is absolutely not safe to use during pregnancy. This is a drug that demands constant respect.
The scale of this problem is just staggering. We're not talking about a couple of rare interactions. Itraconazole can dangerously boost the levels of more than 100 common medications. That's why a doctor or pharmacist has to be a detective and review every single thing a patient is taking before prescribing it.
So, with a drug this powerful and this tricky, how on earth do you use it safely? Well, it all comes down to a very strict set of rules. A user manual, if you will, that has to be followed to the letter by both the doctor and the patient. No exceptions.
And these are the non-negotiables. You always take it with food, period. You immediately report any sign of liver trouble, like your skin turning yellow, or heart failure, like sudden shortness of breath or swollen legs. And maybe the most important rule of all, every single healthcare provider you see, your doctor, your dentist, your pharmacist, they all have to know you are on this medication.
You know, this quote from our source material really just nails it, doesn't it? The drug is a constant balancing act. On one side, you've got this incredible power to cure horrible infections, and on the other, you have this absolute need for meticulous, careful management of its very real risks.
In the end, itraconazole is a perfect story of the trade-offs we make in modern medicine. It's a potent weapon against disease, no question, but it's also a sharp reminder that with that kind of power comes a whole lot of responsibility.